Do you bloat or run to the restroom uncontrollably soon after eating? Or maybe you suffer from a runny nose, rash, headache, heartburn, or other discomfort after you eat? If you experience any of these symptoms, you may be reacting to the foods that you are eating. These foods, even if healthy, can be causing inflammation in your digestive tract that leads to allergic reactions in your body. Hello, I'm Dr. Steve Alavizon. In this video, I will be exploring food sensitivity as a potential cause of your post-meal symptoms. A patient of mine started noticing abdominal swelling after she ate. This didn't happen all the time, but often enough for her to take notice. Over time, the frequency of her abdominal bloating increased until her stomach swelled to the size of a full-term pregnancy every time she ate. She was uncomfortable, experienced heartburn, and had difficulty breathing during these episodes. Each night, she went to bed bloated, but woke up in the morning with a flat stomach and feeling better. The cycle would then repeat itself as soon as she started eating again. After performing a food sensitivity test and avoiding the foods she was sensitive to, my patient noticed that her bloating started to resolve and she felt significantly better each day. After 6 months, she could eat most foods without issue and her diet progressively got back to normal again. So what is food sensitivity? Is food sensitivity an allergic reaction? It is, but not an immediate hypersensitivity allergic reaction most people are familiar with, such as the peanut or bee sting allergy. That type of lifelong allergy can cause your throat to swell and result in death. Food sensitivity is an alternate allergy pathway that is more subtle. Often, if you avoid the foods you're sensitive to long enough, the allergic symptoms will calm down. So how do you test for food sensitivity? We use a blood test that looks for specific immune reactions to specific foods. These panels can be narrow or broad. The broader the panel, the more comprehensive they can identify foods that are causing problems and foods that do not stimulate an inflammatory response. Are medications necessary to treat food sensitivity? No. Avoidance of the problematic food is the best way to resolve this problem. 6 months or more of avoidance will allow most food sensitivities to settle down. Who should have the test done? The best candidates for this test are those patients who have tried to clean up their diet by removing processed foods and artificial ingredients from their diet, but they still have symptoms. These patients should also be committed to avoiding the foods that are causing them problems for a period of time. Are there steps that should be taken before performing a food sensitivity test? Yes. Patients should be evaluated by a medical provider to ensure there are no other underlying medical problems that could be causing the symptoms. Food sensitivity can be significantly disabling. When corrected, the results lead to an improvement in quality of life. A commitment to avoiding the offending foods and maintaining a long-term eating pattern to minimize the redevelopment of new food sensitivities is critical to not end up with the same problem later on. If you would like more information, call Holistic Health Medical Center today at 985-223-3811. That's 985-223-3811 and schedule an appointment. We look forward to helping you achieve the health you deserve. If you like this video, please share it with those you care about.